Hi, my name is Pamela Abascal, and I am presenting the first H&P webcam for summer 2018 acute and critical illness in adults. I am following the trauma group at Del Sol Medical Center, and I encountered this patient in the ICU. He is a 68-year-old Hispanic male that was admitted with a post-MVA in Juarez, diagnosis of flailed chest, multiple right-sided rib fractures, and hemothorax. He is lying in bed with complaints of pain to right side of chest. Patient is on a dilaudid PCA pump, but still requires medication because he complains of pain that is with deep breaths and movement. He states the pain is constant to the right side, but worsens with breaths and movement. He does have a chest tube to his right side of his chest that was placed on arrival in the ER for a hemothorax. The chest tube is to intermittent suction, and Pleurovac shows 75 mLs of bloody fluid, which has not changed since insertion time the day prior. Past medical history, he does have diabetes, which was diagnosed 15 years ago, and hypertension, which was also diagnosed at the same time. He denies surgical history and denies also allergies to medication, food, or environmental. He does have medications, metformin that he takes 1,000 milligrams PO daily, and lisinopril 40 milligrams PO daily. Family history, his mother is still alive. She suffers from diabetes and hypertension. She is 89 years old. His father suffers from hypertension, still alive as well, 90 years old. He does have two sisters and a brother. One sister has diabetes, asthma, and is still alive. Another sister, which is 55 years old, she has hypertension, and his brother has asthma. Social history, he is retired from construction, lives in a trailer home with his wife and one daughter, and he has 3 other children. He denies heavy alcohol consumption, does have occasional beer at family gatherings. He does not smoke and denies illicit drugs. He states their family is very close, and his children often go to their house and are very attentive to his and his wife's needs. On review of systems, neuro, this patient denies dizziness or confusion. He is able to answer all questions adequately without complications. Cardiac, he denies chest pain, palpitations, or shortness of breath. Respiratory, he is on O2 per nasal cannula at 3 liters. He has difficulty breathing due to pain from his injuries but he denies cough. GI, he denies pain to abdomen, has had nausea and vomiting, which has resolved, no diarrhea or bloody stools. GU, he has a Foley catheter that was placed during the night due to difficulty urinating, and upon bladder scan, he had 600 mLs of urine collected, and therefore the Foley catheter was placed. He denies pain he has no complaints of pain. Skin, no abrasions or bruising noted to extremities or face. Bruising is noted to right chest, and chest tube insertion site has a dressing with no redness or drainage noted. On physical examination, a patient appears well nourished. He is in a hospital bed with eyes closed, answers questions adequately. Noted facial grimacing when he takes deep breaths or makes minimal movements. He is alert and oriented ×3. Vital signs are BP 155/74, respiratory rate of 12, heart rate of 100, temperature 97.9, pulse oximetry 95% on 3 liters nasal cannula. Neurologically, he is intact. His eyes are closed, but he is not asleep and he is oriented. Cranial nerves intact. Cardiovascular, he has a regular rhythm, no gallop or murmur on auscultation, and no audible bruits or to carotids. Normal capillary refill. Pulmonary lung sounds are clear to upper and lower left lobes, diminished to right lower lobe on auscultation. No adventitious breath sounds or wheezing noted. GI rounded abdomen, normal bowel sounds, no masses or tenderness on palpation. GU, he has a clear yellow urine noted in collection bag. Extremities, no swelling or edema noted. Skin is warm and intact, no rashes or lesions. Bruising to right chest, pain on palpation to chest. Diagnostic lab work that was obtained was a CBC, and his H&H remained stable at 11.1 and hematocrit 37.3, platelets 153. Coags were PT of 12, PTT 62, and INR of 1.0. On BMP, he had a sodium of 140, potassium 3.5, did notice a BUN of 12 and a creatinine of 1.8. Chest x-ray, there's a right-sided rib fractures 3 through 7, atelectasis to the right lower lobe, and noted chest tube was in place. Diagnosis for this gentleman, his multiple rib fractures secondary to blood trauma. Continue with analgesia and assess pain control with medication prescribed. Encourage patient to use pain medication to be able to move and take deep breaths, and use breakthrough pain medication as needed. Instruct patient to use incentive spirometer. Ask nurse to educate patient on proper use, and make sure the patient uses the incentive spirometry Q1 hour to prevent risk of pneumonia. Encourage mobility and ask physical therapy for evaluation and treatment. Inform patient of staying in the hospital, and pain will remain for the stay that while he is in the hospital, and will continue until when he is discharged, and will diminish with time, may be present for 2 or more weeks. Acute blood loss, continue to monitor H&H with daily labs and monitor chest tube output. If H&H remains stable and no continued output noted, right lung fully expands and no visible air leaks are noted, chest tube may be removed at that time. No transfusion has been required as of now. Acute kidney injury, continue fluids at 75 mL per hour via peripheral IV, and encourage PO fluid intake. Monitor BMP daily for any changes and treat as necessary. DVT prophylaxis with Lovenox 30 mg BID and use of SCDs and mobility, encourage mobility. Thank you. This was my webcam presentation.